This is Dr. Daniel Paull, orthopedic doc with Easy Orthopedics, and today I'm going to talk about how you can tell if you have an ankle sprain, a broken ankle, or maybe even a high ankle sprain. If you like this video, we put out new content weekly, so please like and subscribe. So first of all, what's the difference between them? So a broken ankle obviously means you broke the bones, the medial malleolus, the lateral malleolus. It's just parts of the tibia or the shin bone that kind of come down. And the basic ankle joint is like this. So these are the shin bones here, and here's the top bone of your foot, or the top bone of the ankle joint, which is called the talus, okay? So when you break these bones out here, that would be an ankle fracture. But when you don't break the bones, but the ligaments that attach the bones, that would be considered an ankle sprain. There's, I'd say, 4 main ankle ligaments. There's 3 on the outside of your ankle, and there's 1 on the inside. Now there's a superficial and deep layer there. I'm just kind of simplifying things. So if you just tear those and the bone doesn't break, that'll be an ankle sprain. There's different grades based on how many of those you tore or how bad you tore them. And then there's the high ankle sprain. So the high ankle sprain doesn't really have to do with the bones here. It doesn't really have to do with the ligaments connecting to this top talus bone here. It's really more to do with the ligaments that connect the tibia to the fibula. So your shin bone here, this shape I'm making actually has 2 bones in it. So it's when those break apart, and actually your shin bones can actually kind of come apart like that. That would be a high ankle sprain. So how do you know which one you've got? So if you have deformity of your ankle where, like, I'm not saying it's swollen, but I'm saying it looks like out of socket or looks like something funny, it's almost very, very likely that you broke it, right? That means that the ankle bone's broke and now it's not being contained anymore, and it'll sort of bust out the side or something like that. You'll have swelling with any of the 3 injuries if they're bad enough. You'll have bruising with any of the 3 injuries. Bruising can come when you have damage either to the ligaments, which means blood comes out because you tore the ligament, or the bone. Blood will come out too. If you have pain more over the actual bone, then it could be a fracture, but you could also have a sprain even if you do have pain over the bone. So how can you tell? If you're able to walk on it, it's usually not a bad ankle fracture. However, there are some ankle fractures that you can walk on if they're not terrible, unless you're diabetic, in which case I've seen people with bad ankle fractures who still walk on them. So generally speaking, the way to tell, and a lot of people hate when I say this, is to get an x-ray. Like, that's the only way to tell in a lot of instances. I mean, if you're able to walk okay and you don't just have a little bit of pain over the front of your ankle, and then it's probably not broken. But if you can't walk on it, you really need to get an x-ray. An x-ray will tell you if there's no broken bones, then it's probably a sprain. Determining if it's a high ankle sprain is a little bit more difficult. You sort of have to stress the foot and get a stress exam of the ankle to tell there. But this topic is somewhat, everything's overlapped and everything can sort of look like everything else. So basic rule of thumb, if you can walk on it and you're not diabetic, and it just hurts along the front of the ankle, then there's probably just like a mild ankle sprain. If you've got bruising and you can't walk on it, you got to get an x-ray to make sure it's not broken. If you wait too long to get that, then it's very difficult to fix. For high ankle sprain, it's a little bit more subtle, a little higher up. X-ray won't show any broken bones, but a stress exam of the ankle might reveal that the tibia is separating from the fibula, and that will determine if you have a high ankle sprain. So I hope I was able to answer your questions. Again, somewhat a confusing topic, multiple injuries in the same location. Again, rule of thumb, you can walk on it, just hurts sort of in the front of the ankle and it's getting better, it's probably an ankle sprain. If there's bruising and everything else like that, could be broken, could be a really bad ankle sprain, you need an x-ray. So I hope I was able to answer your questions. I can't give you any specific medical advice over YouTube because this video and all my videos are for educational purposes only. Thanks for watching.